Dr. E's on here talking about something I call paintbrush shoulder. That's impingement syndrome of the shoulder, otherwise known as bursitis tendonitis. It occurs when you're doing things you're not quite used to, say painting a wall overhead or doing your maximum weight. Okay, 3 pounds is my maximum weight, and doing overhead presses. Impingement syndrome of the shoulder can be quite painful, and here's what to do. It used to be called bursitis and tendonitis, and frankly, it's when the shoulder jams up the rotator cuff and then the bursa swells and you have pain with a lot of forward flexion and overhead movements. Over time, that can develop from tendonitis to something called tendinosis. You can get partial tears of the rotator cuff and even up to full tears of the rotator cuff. So what causes it? Basically, it's poor posture, having rounded shoulders, having a lot of overhead activities that you're not used to doing. You can also do it with throwing, and you can do it basically when your upper back is not as strong as your chest and you're a little bit more forward. A lot of us do push-ups, very few of us do some pulling type exercise. You can have it with a fall, you can have it with wide grip exercises and doing a good old weightlifting overhead. You could do it with some other activities such as a pec deck. Sometimes we just don't know what causes it. The diagnosis is usually started with the history, and that's usually with the activities. On the physical exam, we'll move the shoulder in various ways to try to elicit the pain. Sometimes we can do x-rays to look for bone spurs. There are times where you need an MRI if we worry about a rotator cuff tear. And in terms of treatment, luckily there's a lot of options that can be done. Number one is avoid activities that irritate, especially overhead activities. You want to ice it 15 minutes before you go to bed at night with like a water-based type ice. We do a lot of upper back exercises, really emphasizing the pulling. So this one is the cable row, and you want to slow 5 count in and then 5 count out. That's called the eccentric. You can do internal extra rotation. Those really get the rotator cuff muscles. And an advanced move is to eventually build up to learn how to do the two-handed kettlebell swing that truly works the upper back muscles eccentrically. There may be some medicines that we'd use, some anti-inflammatories such as Aleve or ibuprofen. Sometimes we use some muscle anti-spasm medicines. Sometimes we'll do formal physical therapy. Now and then we may end up having to inject the bursa to shrink that down, so you might have heard of a cortisone injection. And finally, the last part is we may have to do surgery where we go in and smooth out or shave off that bone that's sticking down. So in summary, paintbrush shoulder, very common. It is something that can be treated. Let us know if we can help. And remember, ease on down the road to good health.